Hey everyone, welcome to this episode of the Organisational Inclusionist. My name is Grace Mosuro and I am your host. Today I am joined by the wonderful Marjani Orchery. Marjani is a dentist, a medical doctor and the founder of SMILEquity. So I never feel like I can do individual introductions justice or the justice that they deserve. So I would love you to introduce yourself to everyone in a second, Marjani. But before I get you to do that, just to give a bit of context. So today's conversation is going to be about Marjani's amazing work in oral health and her vision and dream for the work that she's doing and how she wants to reach people and how she's hoping this work will benefit people. We met virtually, oh my goodness, over a month ago now. It's mad. Feels like it was more recent. And I was just blown away, firstly, by your teeth, because they're beautiful. But secondly, by the fact that I don't know anyone else doing what you're doing. And I think what you're doing is so valuable. It's so necessary. And I think it's going to be so impactful. So I just felt like it was something that I needed to get onto the podcast to share with people so that people know of you and they know of the great work that you're doing, because sharing is caring. So, Marjani, please can I hand over to you? If you could just introduce yourself to everyone. So who are you and what do you do?
Okay. So hi, everybody. My name is Marjani Orchery. And my background is that I am both a dentist and a medical doctor. And I'm also the founder of SMILEquity, which is an organisation committed to delivering oral health education. And that's my main passion and main focus and main drive to make oral health education available, accessible for everybody.
Amazing. So what would you say led you to, because like you said, you're a dentist, you're also a medical doctor. Can you just talk us through that journey? Like what led you to become a dentist after training as a medical doctor?
So it's actually the other way around. So I was first a dentist. So that's after I finished my A-levels, I went to dental school. Mm-hmm. And I worked as a dentist in general practice for a few years. I did some time in hospital as well. And what I was finding is that, I really wanted to understand the human body and know how to help people holistically, completely. And so for that, I felt it was necessary to go and retrain as a medical doctor. So following that, I went back to university for another 4 years, plus a master's, to do my medical degree and then qualify as a medical doctor.
Wow, that story is phenomenal. Like I know, especially once I got a taste of money and like earning, the idea of going back to studying was like, no, we're not doing that. So I applaud you for your commitment. And I think that it really speaks to your passion for what you're doing at the moment and kind of your reason for doing what you're doing. SMILEquity. What motivated you to start the business? Like you've trained as a dentist, you trained as a doctor, and now you're an entrepreneur and you have your own business. What led to that?
It was looking around in society and constantly hearing stories about people saying, I can't access the dentist, I haven't got a dentist. And also being in hospital and seeing how many people were having dental issues. And I think it's really bringing everything together, everything that I've trained in, to know that health inequalities is a huge issue in this country. And though we're, a developed country, a lot of people can't access that care. And unfortunately, we need a lot more in that arena in delivering health equity. And there are places in the UK where, you can't get a dentist at all. They're dental deserts where they just don't have those resources built in to the structure of that, community. And people are really suffering as a result of that.
Oh, wow. See, I think when you raise something like that as well, it just really highlights how we take things for granted in places where we do have that. But also, I mentioned this when we first spoke as well. I remember, so I moved to the UK when I was 5. With my parents, with my mum at the time. And I didn't go to the dentist until I was in year 6 of primary school. And it was the most traumatic experience of my life. Like, I still remember it because the dentist flossed my teeth for the first time. And there were all sorts of things in those teeth. Like, it was disgusting. But I remember my gums bleeding like crazy. And I was in so much pain. My mouth was swollen. My gums were swollen. And I remember like having a go at my mum, like, is this all your fault? I'm in pain because you never told me I needed to. And I remember how pained my mum was in seeing me in pain and also being blamed by me for that, which I feel awful for now. But what you said about, you know, just people not knowing or people not having access, you know, my mum came to this country and she was still getting her bearings for a number of years. Her focus was on making sure we had food on the table, making sure that we were going to school, making sure we were alive, making sure we were staying out of trouble.
Yes.
So for her, like, dentistry was a luxury. It was something that was, we'll get to that when there's time. And it wasn't something that was front and center for her. So I think the work that you're doing is so important, but also learning from those experiences as well is so, so important.
Absolutely.
My daughter is at the dentist every they won't see her every 3 months now. They said she's old enough for every 6 months. But it has made me really obsessive about her dental care and her oral hygiene because they say when you know better, you do better, right?
Yes,
and
true.
I'm definitely trying to do better for my child. You mentioned some like areas where there just isn't any, you know, people don't have that readily available access to dentistry or to dental practices. Where are some of those places? Because obviously I'm in London, so we've got dentists like on every corner. But for anyone that's like a Londoner who doesn't necessarily get it, like, where are some of those places?
Most of those places are concentrated in the most rural parts of the UK. So in London, for instance, you have a couple of dental schools. In other big regions, you have dental schools which will produce dentists effectively. But in these regions, you don't have that. So it's not just not having the dentist, but a social infrastructure. So people might be facing homelessness or other social issues as well at the same time as this health insecurity.
For people living in those areas, what can they do, if anything, to impact a change in that? So in maybe the creation of schools in those areas or just more practices being created, is there anything they can do?
What I would say is that is part of my purpose with SMILEquity, because the main dental diseases, which are tooth decay and gum disease, largely, there are exceptions, but are mainly preventable. And that's through having that knowledge, that understanding of how to care for your own dental hygiene, which can make a big difference. And it's that preventative area that I'm trying to address most of all. That being said, you know, if you've got a toothache, you need to see a dentist. Yeah, all of the education is not going to help in that acute setting. So there needs to be resources that people can actually see a dentist when they're in pain and then have that ongoing continuity of care. But that, you know, that is a bigger issue than one person. That is a whole governmental, societal, health policy issue that needs to be addressed.
Absolutely. So you mentioned about kind of the government aspect and the policy piece. Is that some of the work that you're going to do as well? So do you see yourself getting involved in lobbying and getting involved in some of those conversations?
I mean, that is something I could aspire to. I would aspire to. But as I said, that needs that collective effort. Again, SMILEquity is all about collaboration. So it's working with different people, different agencies to try and get this the message across. And it will take time.
Yeah, definitely. Unfortunately.
So this is a problem that has been going on for, you know, probably decades. And whilst we might see more of it now in the media, to rectify that it's still going to take a lot more time to get on top of that and put the infrastructure in place to help these communities.
No, definitely. You mentioned about like a lot of the work that you're doing is about prevention, and I love that as well. Like, you know, my mum used to always say prevention is better than cure.
That's it.
So true. And you know, and I think one of the things that you said also when we first spoke was about, you know, if we can get the prevention right, we will save a lot of the pain and the issues that people have further on, but also save a lot of the money potentially that people have to spend rectifying some of those issues.
Absolutely.
What kind of advice are you giving people around preventative oral health care?
Okay, so it's really simple things to do. Brushing twice a day. The main time to brush your teeth is before you go to bed at night, and one other time in the day. Okay. Using a fluoride toothpaste. Keeping sweets, things like that, to meal times, not snacking on sweets throughout the day. And also working in collaboration with dental professionals, seeing your dentist for regular checkups. A lot of people get into a habit where they think, oh, everything's all right, I don't need to go. Okay. But with all the best will in the world, you know, you can't see between the teeth. You can't see that. And that's why dentists have x-rays and other special tests that they can use to actually investigate and examine the teeth. So it's that part as well, working in collaboration with the professionals and the patients and the communities.
Amazing. You mentioned at the start of this conversation as well about just the overall inequalities in oral health care. So for people from marginalised backgrounds who maybe haven't been to a dentist before and don't even know how to access one, what would your recommendation be to them?
You know what's often the best way to access someone? Ask a friend. Have you got a friend who's got a dentist who can recommend you to someone that they trust? So there's that. Or alternatively, if you search find a dentist and NHS, you can look for the nearest dentist that's taking on NHS patients in your region. But I also think it's good to talk. Good to talk to other people, see their recommendations.
Definitely.
And those would be the main ways, yeah.
And for people that don't have, you know, access or readily available access to the internet, for example, where are they getting this information?
That's going to be a difficult one if you don't have access to the internet. Because most of the information, health information, is confined to the internet. Sorry?
Can they get it from their GPs or from like job centres? Would they recommend dentists?
GPs don't necessarily readily have a list of dentists available because medicine and dentistry are quite separate entities. So in the event of an emergency, or if a patient turns up to the GP and says, I've got toothache, they would say, you know, phone 111 and they can get you to see an emergency dentist. But in terms of having that regular care, there's not so much that joined up kind of thinking between all the healthcare professionals and agencies, which again brings me back to that point that this is about collaboration. It is about working with all of these people to get that message across. And also what I find now that I'm trained as a doctor and a dentist is that in medicine, oral health is largely not a part of the curriculum. So they don't cover it. It's not really, you know, a foundational element. But in general, most people have teeth. So it's still a fundamental part of the body.
Absolutely. And do you know what? When you were speaking about, you know, that it is difficult and it's about collaboration, I don't know why, it got me really excited about the work that you're doing, because we've already identified where the gaps are. And I feel like with the work that you're doing, even though there's a lot of work to do, like I'm really excited about the impact that you're going to have, because so many people need what you're doing. And I think it's such amazing work. And the fact that you have both perspectives as a dentist and a medical doctor will really help with that collaboration piece. So I just got really excited.
Oh, thank you, Grace. That means a lot, actually. And it's about just getting that message out, letting people know about it, and raising that level of awareness that people really understand that this is not something I can do on my own. You know, I need other people to come along for that journey, you know, advocating for the patients, advocating for the communities, that we can have the resources and that preventative care to really help, you know, empower people as well. Empowerment is the key as well.
Absolutely. So in 5 years' time, what would you say your vision is for what you've achieved through SMILEquity?
Oh, wow. That's a great question. Honestly, I would like SMILEquity to be a national recognized body, and something that, you know, people can access wherever they are. They know SMILEquity, you know, this is going to give us that information, you know, different arenas, educational, schools, clinics, wherever there is some ability for people to access healthcare education on a community level. And that, you know, as you were saying, with access to the internet, not everyone has access to the internet. So in places where, you know, we do it face to face, so you have that kind of human interaction, that people can ask questions, you know, and they feel that, you know, there's that connection, that human connection.
No, absolutely. And I think that human connection is so important because, you know, I suffer from brain fog. So sometimes when someone tells me to go and look for something on the internet, I'm like, can you just tell me what it is? Can we just get on a call? Because the idea of reading loads of different bits of information blows my mind sometimes. And so having that human element just changes the game for people that struggle with, you know, that have different ways of learning, etc., and just being able to ask questions and get direct answers rather than having to go away and try and work out what all of this information means. I think that in itself is going to be really transformational. So how can people get involved with you now in the work that you're doing?
Yeah, so you can contact me directly through smilequity.com, SMILEQUITY.com. I'm on LinkedIn. I've just kind of started my Instagram and TikTok, but these are things that will be building in future.
Yeah, definitely. Yeah. And I will add a link. I'll add any of the links that you have on the bio for this post as well. So who are you currently not working with, but what types of people are you working with at the moment? Just to give listeners a sense of who should get in touch with you.
Yeah, so I've done some webinars with the Caribbean African Health Network, which was a network that developed during the pandemic to address some health inequalities regarding the Caribbean African communities in the UK. And that was involving talking about sugar and oral health and ways in which sugar affects your teeth, but looking more holistically as well. And then also with some more local charities, I've been in GP surgeries talking to people there about their oral health, asking them about brushing their teeth and kind of giving them that education on that one-to-one, face-to-face basis as well.
Amazing. And schools, when are you, because you mentioned schools, when are you starting to work with schools? Because I do feel like there will probably be a number of teachers that listen to this that be like, actually, some of our kids need this advice.
So that is something we're still in the planning stages of, but as I said, it's about education everywhere and anywhere, and where you can capture people. So for instance, with kids, I mean, you want to get them in those habits for life. So when they're young, you establish with them, you know, this is how you need to brush your teeth. This is why we need to brush our teeth as well. And it's establishing those habits that they can keep their teeth for life. Because in effect, you should be able to keep your teeth alive. In the historically, people used to lose their teeth. You know, you used to see old people with dentures, but you know, you don't have to do that anymore.
That is amazing. I always thought you lost your teeth as you got old, like they just fall out.
And that's a common thought as well. Definitely, people people have certain ideas about dentistry, but the truth is dentistry has changed a lot since, when people were children. When adults now were children, it's come a long way. Even the communication between the dentist and the patients is different. We focus much more on those interpersonal skills during the training. So it doesn't have to be painful as well. It shouldn't be painful. Things have improved massively, and dentistry keeps on innovating and developing and changing.
Amazing. What would you say some of the challenges have been for you in the work that you do?
It's about getting that awareness out there. And there are so many issues going on. We've got the climate change, we've got sustainability, other health issues, homelessness or cost of living crisis. All of these things are going on at the same time, and they all affect each other. So it's not like they exist as one separate issue. If you are, in insecure housing, okay, how are you, and you're thinking about, what you're going to eat for the day, the last thing on your mind might be going to the dentist.
Exactly.
So I always say this, it's about systems and understanding how systems intersect with each other and joined up thinking. So not just thinking, okay, teeth and that's it. Teeth are affected by the rest of the body. For instance, gum disease and diabetes have a synergistic relationship. So if the control is poorer, then the gum disease is often poorer as well. So it's about thinking about everything all together, and that is a challenge as well. Another challenge is that dentistry and medicine function as separate entities. There's not that much interaction between the two. And access is going to be, a big one. These areas, as I've said, where you cannot get a dentist unless you're able to travel, it's a very, very difficult problem to address.
And are there any organisations that you know of or that you're working with that you'd signpost people to that are maybe struggling to access free dental care or struggling to just get support in that area?
Sometimes if people are struggling, you can approach some dental schools because the students need patients to work with. But again, that lends itself that you need to be near enough to a dental school, and there's not that many dental schools in the UK. So that's difficult. As I said, in these areas, it's just so resource poor that there isn't that much. If you're out of that kind of catchment area in the bigger cities, there isn't that much available, unfortunately.
It is unfortunate. What would you say to anyone that wants to understand a bit more about the inequalities in oral health care? Like how do people get more aware of what's really going on?
Yeah, I mean, if you have access to the internet, if you type in health inequalities, you will get a raft of information coming up. And with the internet, you always want to look for credible resources. So something like the World Health Organization, the NHS, you've got think tanks like the King's Fund, which deal with healthcare. I mean, whatever you want, you can find it on the internet, but I would suggest stick to the more reputable kind of organizations to get your information from.
And how can people get involved with the politics of it all?
I mean, I think politically speaking, the best course of action would be to directly go to your MP in your area. So MPs hold surgeries within the community where community members can come along and discuss certain issues. And I know a lot of MPs have brought this forward into Parliament, this issue with dentistry in the UK. But again, it's, it's above my pay grade, but these decisions within, the government lobbying, that is going to take a lot of kind of political will and also money.
Yeah. I think one of the great things one of the good things is that we are nearing a next round of elections. And so politicians are very, very keen to get seats. So I feel like now is a really good time for those conversations with MPs to start happening,
Absolutely.
particularly in the rural areas that you mentioned that maybe don't have readily available dentist practices or schools, is to start looking at actually how you discuss healthcare inequality with your MPs and how you try and get that front and centre, particularly with those that are really desperate to get in, because not everyone is, but some are. Those are the ones you want to lobby, the ones that are likely to get in, is really start to look at, how do you impact that policy before they get into power, because it is something that's needed. And it would be a great testimonial for them in their new positions to be able to say that this is something that they brought on. So that's
absolutely
something to add and recommend.
I mean,
Go on.
Oh, sorry. I think it's about, that legacy as well, that
absolutely
in 100 years, can we look back on this time now and say, we did something meaningful to really shape the course of healthcare in this country and make it so that it's equitable, that people can access it, that people have that knowledge. I mean, we all train for years and years to acquire all this knowledge, and we want to give it out. Let people know, all of the ways, all of the tips, the tricks and techniques that they can use to protect their healthcare and their family's healthcare.
No, amazing. Thank you so much. So I always like to end these podcasts or these episodes with a call to action to our listeners. So what would your call to action be for anyone listening, whether that be an organizational leader or a parent, anyone listening, like what would your call to action be today, Marjani?
Yeah, my main message would be access dentistry. See your dentist regularly. Keep on top of it. As I said, prevention is the key with dentistry. Okay, and the more knowledge you can develop and learn, that's knowledge for life. And it's about developing these healthy habits, not just in yourself, but in your children, so that future generations can benefit from the knowledge and have healthier, happier lives and great smiles.
Amazing. Thank you so much, Marjani. I think this is such an important issue, and I think the work you're doing is so important. So I'm really grateful for the work that you're doing. And I think that a number of our listeners are going to take some things away from this in terms of what they want to go and do or what they need to go and do, whether that be to educate or to influence. So I just want to thank you so much for joining me today and for just sharing your expertise, but also the amazing work that you're doing. And I wish you all the best with it. And if there's anything that I can do to support you in the future, obviously just give me a shout.
Thank you, Grace. Thank you for having me. It's been wonderful. I've really enjoyed this.
Pleasure.